Hi, Stefan here with Iron Direct Primary Care. I'm going to talk to you about our chronic pain management approach here at Iron DPC. The first step is to remove inflammation. This means removing alcohol, processed foods, smoking, tobacco, really all your junk foods, your seed oils, your processed breads. People ask me, what about like Dave's Killer Bread at Publix? Dave's Killer Bread is viable for like 3 to 4 months on the shelf. This stuff does not digest well. It's highly inflammatory. You want to get a real bread. It's bad in a day or two. Like if you go to a good bakery, it makes artisanal bread, it's bad within 2 days. The bread out there is toxic. Don't eat it. It's highly inflammatory. Avoid all the soybean oil, canola oil, cottonseed oil. Going out to Wendy's, going out to Chick-fil-A, going out to restaurants is not high quality food. It's high inflammation. All of this, you cannot outdo a bad diet. So that's first and foremost. Get rid of all the junk. Next, the most important pain management therapeutic procedure we've identified here at the practice is cryotherapy. That's whole body cryotherapy. For us, that's the cold forge, the Morosco cold forge, between 34 and 36 degrees Fahrenheit. Not 40, not 50 degrees Fahrenheit, between 32 really and 36. That's kind of the sweet spot. That's freezing temperatures, ice water. This provides a whole body anti-inflammatory effect. This provides immediate pain relief for patients. You can also do nitrogen cold tanks, which we don't have here, that are a little bit more expensive. Movement, exercise, and physical therapy. Movement is key for pain management. That's resistance training, running, even sprinting, aquatic sports, anything that your body can tolerate, you want to do. Physical therapy is also very important. You want to keep moving. You stop moving, you get things like adhesive capsulitis, frozen shoulder syndrome. You don't want that. You want to keep moving. Hormone optimization. That's what we do here at Iron DPC. Hormone optimization is part of routine primary care. This is nothing special. This is what everybody should be doing. You want to make sure you're sleeping well. One of the greatest compounds we found for this, thanks to Chronic Disease Prevention and Management Group and Dr. Saladin Halassa and Dr. Joseph, is cyclodextrin mixed with progesterone intranasal for sleep. These two compounds have proven very powerful immunomodulatory, anti-inflammatory, decrease pain signals, really help with sleep. Men and women can use this. Oral progesterone works just as well. You can do it intranasally, topically. We like intranasal as well for immediate effect. Mixed with cyclodextrin for excellent delivery mechanism. Testosterone. Testosterone improves tendon ligament strength. So you want to optimize testosterone, whether you're a man or a woman. You both need testosterone. If you have low testosterone, you're more prone to rotator cuff injuries, labral tears, not healing. I think all orthopods out there should be measuring testosterone as part of routine practice before doing surgeries on patients and optimize testosterone. If you can optimize testosterone, you're going to have a better recovery from the surgery. Patients are going to heal quicker. They may be able to prevent surgery as well if they do PT and some of these hormones, right? Because testosterone is anabolic. What does anabolism do? Grows the muscle, grows the ligaments, grows the tendons. That's what we want to help with these chronic weak joints, these chronic painful tears. That's how we treat it. We strengthen the body, right? DHA and pregnenolone, these are neurosteroids. They're going to modulate pain signals in the brain. DHEA is very important for your bone health. Pregnenolone is very important for your brain health. Pregnenolone is also the precursor hormone of all the hormones in your body, including cortisol. If you're giving the patient exogenous cortisone, you're giving them cortisone injections, because that's a very common procedure out there, you should be balancing the hormones. You should be giving them back pregnenolone to support cortisone. You should be giving them testosterone to balance the negative effects of cortisol. Cortisol in and of itself is not a bad thing. The problem is unopposed cortisol. What does unopposed cortisol do? It degenerates the body. You get weak bones, you tear your ligaments, tear your tendons, your muscles waste. We all know the side effects of cortisone. However, cortisone is a natural hormone in the body. We need it. Patients with low cortisone, they can't get out of bed. They feel terrible. Cortisone is also anti-inflammatory, helps with pain. But the problem is too much cortisone and not enough anabolic steroids, which, sounds crazy, anabolic steroids. DHA, testosterone, okay? These are your anabolic steroids. There's nothing crazy here. This is natural. Estrogen, E2, very important for joint health. Yes, men, you need estrogen as well. Don't try to crush your estrogen. If the man has crushed his estrogen because he's taken loads of aromatase inhibitors, he's going to get joint pains. This is well known. You cannot crush estrogen. You need testosterone to produce estrogen for men. For women past age, menopause age, you do not produce estrogen. So osteoarthritis, bone disease, joint inflammation, inflammation in the brain. You need estrogen. Gives life. Now we're getting to a bit more spicier ones. Nandrolone decanoate. This is an anabolic steroid. It's 10 times more potent than testosterone. It's very good for joint health. It's been studied in osteoarthritis, and it helps women with osteoporosis and osteoarthritis. It's an injectable medicine, low dose. You do great on this. You don't abuse it like a bodybuilder would, and it's a great medicine for helping joint health, ligaments, tendon repair, and wound healing. Thyroid hormone, iodine and selenium. Thyroid hormone is also very important for pain management. Low thyroid hormone leads to chronic pain, arthritis pain. So we want to make sure thyroid hormone is optimized. You look at a free T3, you look at a free T4. You want a free T3 between 3.0 and about 5. You don't want it below 3. Don't follow the TSH, follow the T3 free, the T4 free. You need iodine and selenium. Everybody needs to be taking iodine and selenium. There's no ands or buts about it. If it's too low, everything's, you're doing everything still low, you prescribe NP thyroid, Armour thyroid. This is natural desiccated porcine thyroid hormone. It's natural. Think of it like an organ supplement. It has both T4 and T3 components to it. You take it every day on an empty stomach. It works great to give you back that immediate energy, that T3. Then the T4 converts to the T3 if you're taking iodine and selenium. Boom, thyroid hormone is optimized. Now some other esoteric things. Low dose naltrexone, LDN therapy. This is one of the best medicines out there for autoimmune conditions, chronic pain, neuropathy. You want to take it 1 milligram or lower. Start low, 0.5, 1 milligram. Usually start them at 1 all the way up to 5 milligrams. If you Google this, you're going to be like, oh my God, this is for heroin addicts. Yeah, that's 50 milligrams to 100 milligrams. Low dose naltrexone, 1 milligram to 6 milligrams max. That's what we use in functional medicine pain management practices, more on the cutting edge, for pain, autoimmune disease, spike injury, you name it. Great drug. Take it at night. The worst it can do is give people vibrant dreams. Intranasal oxytocin. Oxytocin, this is the love hormone. This is a peptide as well. We can deliver it intranasally, sometimes combined with cyclodextrin for optimal delivery mechanism. It goes right to the brain and provides that sense of wellness, relaxation, improved relations. It's anti-inflammatory, it's immunomodulatory, so it's a great medicine for all of these chronic arthritic, autoimmune, inflammatory conditions. Other ways to influence inflammation. Omega-3. I tell you what, everybody has high omega-6, and you can try to avoid the seed oil as best you can, but for the most part, people aren't consuming enough omega-3 fatty acids. They need to consume between 2 and 6 grams a day of omega-3 fatty acids. You want to improve your 3-to-6 ratio. You can measure this in the blood, but I've never actually seen a good one unless people are actually taking omega-3 fatty acids every day. N-acetylcysteine and glycine, these are your precursors of glutathione. If you have chronic inflammatory conditions, you are burning through your glutathione. You need more glutathione, especially if you're taking the narcotic or Tylenol type medications. Tylenol burns through glutathione, so you need to take more NAC and glycine to detox that. NAC and glycine produce glutathione. Now you can take glutathione directly. You can do that injectable, transcutaneously, sublingually. They can work to a degree, but you still need to take NAC and glycine. My recommendation for my patients is take 2 grams of NAC glycine every night. Monitor it. You can measure glutathione in the blood. You can measure cysteine in the blood, and you can determine if you're still deficient in it. Turmeric curcumin, well-known anti-inflammatory spice. It is great for pain management. It's anti-inflammatory. It reduces CRP. It's really well tolerated. It doesn't have many side effects. Collagen and vitamin C. If you have joint issues, you want to repair collagen. You may have gotten hyaluronic acid injections in your joint. Great therapy. You still need to take collagen and vitamin C. Vitamin C helps with collagen synthesis in your joints. Other ones, near-infrared and infrared light therapy. We've had tremendous success with this for people's pain, including trigeminal neuralgia pain. We've had patients have complete resolution with trigeminal neuralgia with physical therapy and infrared and near-infrared light therapy here at the Human Performance Arena Center. Hyperbaric oxygen therapy. So hyperbaric chamber, this is a tubular structure. You breathe 97% pure oxygen. You go under, think of it like 14 foot underneath a pool. So this is a higher pressure environment. The idea is to put oxygen into the tissues. Hyperbaric therapies are known to treat osteoarthritis, arthritic conditions, autoimmune conditions. They help heal tissue. It's very commonly used for diabetics' non-healing wound injuries. It helps get oxygen to areas that aren't oxygenated. Low oxygen conditions can be painful. Hyperbaric therapy is a little bit expensive. We do have sources for that, but it's a bit tedious. You need to spend at least 1 hour a day in there. You need to be mobile enough to get into a chamber. Usually they're laying structures. They're not always user-friendly, especially if you have chronic pain and you can't get in and out of tight spaces. And then my favorite, personal favorite, is the Wolverine Protocol, BPC 157 and thymosin beta 4. This is typically done through an injectable peptide. You deliver it into the body subcutaneously, or you can do it orally. We have also done it here at Iron TPC intra-articularly. So we often will mix BPC 157 thymosin beta 4 with the patient's own platelet-rich plasma and platelet-rich fibrin. We've injected it into the knee joint to great success, and we've actually had a couple very good successful stories of return to activities, no pain, meniscal tears healing without surgical intervention. You can also use BPC 157 orally. You can do it intranasally, subcutaneously. It works for a whole systemic effect for regeneration, not just a local benefit. However, there is a little local benefit. That's why if we do have an injury that's easily accessible, like a bit of a shoulder injury or a tendonitis, tennis elbow, you can inject it right into the area of injury, and it promotes a local healing effect. So this is our protocol for pain management here at Iron DPC. We've been extraordinarily successful with this. Pain is probably my favorite condition to treat right after chronic fatigue. So the most challenging conditions you can think of in medicine that everybody else rolls their eyes at, I love these conditions because we have so many therapeutics, so many ways to treat this and optimize the patient to get them back on their feet and get them back to what they want to do. Hopefully you guys found this educational.